All right, thanks, Nick, for visiting. For this interview, I'll take off my mask. It's just you and I, and we're more than maintaining social distance. And you have a mask on, so it is appropriate for me to be able to answer these questions without wearing my mask. We have started, as you know, the community COVID-19 testing clinic. We've held clinics in Harrisville, Beaver Falls, and Lowville on the hospital campus. And I just received a report at the end of the day yesterday talking about total numbers. I can tell you that we have held 7 clinics, and we have had 179 individuals go through the clinic. The vast majority of those individuals are from Lewis County, 147 of them, 17 individuals from Jefferson, and 2 individuals from St. Lawrence, and 4 individuals from out of state, and then some onesies and twosies, mostly visitors to the Lewis County region, who, individuals who have camps here. But in total, 179 individuals. One of our clinic days, which was a Lowville clinic, had 62 individuals come through. And our last clinic in Lowville, which was yesterday, we only had 5. Our last 2 clinics, we've had a total of 14 people. Over the course of the 7 clinics, we've averaged 26 people a day. So it's sort of trending out the way many of us thought it would. There was sort of this nucleus of people early, and now it has trickled. But we have clinics scheduled for the month of August, and we will be back in Harrisville on the 12th. We will be visiting Lion Falls next week, and then we'll have another visit to Beaver River. And on Mondays and Thursdays, we will continue to run clinic in Lowville. The one change that will begin next week, instead of the clinic being 3 hours, we're going to drop it 1 hour, and it'll be 2 hours. Our volume of throughput doesn't support staffing at this point for 3 hours. So that's something we will continue to evaluate, and at the end of August, we'll see what other tweaks we need to make to the program. I would say, by and large, the program has gone well, with the exception that the test results are not coming in as quickly as we would all hope. Right now for the clinic, the average length of time is 8 to 10 days. We have communicated, I guess our concern with the reference lab, which is under contract by the state. I have also expressed, this feedback to the governor's office, which is who we worked with to develop the partnership. I sort of understand, across the country, there has been a growth in the length it is taking to get the results of the test. We're seeing it with our regular hospital testing program, both for inpatients, emergency department visits, and preoperative testing. It's taking 5 to 7 days with LabCorp. So I think what it comes down to, there's been a surge on the testing facilities, and I think the lack of a federal program, federal plan, so that the testing is better organized and planned, is impacting our ability to get the results more quickly. As we get into the fall and we have flu season, potential challenges with another wave, we really have to get this issue of test results done more quickly and expeditiously resolved. So more work to be done on that.
Okay. And so just so people locally here are clear, the free clinic testing program, this is completely set up through the state. So you guys aren't processing the results here at the hospital or anything like that. Everything is under contract by the state, and they're going out to a different process lab than what the hospital normally uses. So when it comes to getting the results back, that's really out of the Lewis County Health System's hands.
That is correct. The state developed a contract with BioReference, which is based out of New Jersey. So that's our vendor for this program. And, our responsibility is to provide the staffing, organize the clinics. We went a step further and, developed not only clinics in Lowville, but in 3 of our communities outside of Lowville. And all of that's worked, pretty well. The team has done a great job. Public health working with the health system. We're each providing staff support for the clinic. Our local manager and our CMO, Dr. Harney, are really on top of it, doing some good work. Tests are leaving, and like the individuals who have been tested, we are just simply waiting for the results. So,
okay.
And this isn't about finger pointing. Whenever you initiate a large-scale activity, there are always operational bugs you have to work through.
Right.
I think on our end, we've worked through those bugs pretty well. In fact, the biggest challenge locally was in Lowville, navigating the traffic flow, while also having to accommodate deliveries that were being made to the health system. But with help from our facilities department, I think we've worked through that pretty well.
Okay. And we did invite Public Health to come in and be part of this interview today. We didn't get a response from Public Health. I know that we had talked earlier about when we get the daily report from Public Health, the way that the data is reported, the testing data from the free clinics is incorporated into the report a little bit differently. Would you like to speak on that? So when people are seeing the column with pending results and things like that, that is with the LabCorp testing that the hospital is providing. With the free clinic testing, nothing is going into the data until the test result comes back. Is that?
That's my understanding. Okay. So, I think those are good questions, and we'll let Public Health answer those. There are 2 separate databases right now, and the way it works is, for the clinic, we gather contact information from the person submitting for the test, and usually email. That allows them to get the results just like we do through a group report. They get their individual results. And we've had no positive, by the way, through this program. But if there were a positive, Public Health would be notified, and then Public Health would reach out to the individual to initiate the contact tracing. So the good news is, we've done 179 tests as of yesterday, and so that's good. We'd like the number to be higher, but we've had no positives identified to date, and however, the frustrating news is we don't have the results for all 179.
Right. Okay. So moving on, just really quickly, the last time that we spoke on camera about the rapid analyzer equipment that the hospital had purchased, I think obviously it's another nationwide problem with reagents and things that you need to carry out the test. Can you just give our audience an update on where things stand with the rapid analyzer? Is that online yet, or have you gotten any further guidance on that?
Yeah, so over the last couple of weeks, it's probably been one of those things that has been most frustrating to me. In fact, I was talking to our lab director yesterday to get an update, essentially, when are we getting the reagents? And he basically said, they've been ordered, the order has been accepted, they haven't arrived yet. What's happening in the West, in the South, and in the Southeast has really put a strain on the reagents. It's important to us, but there are parts of our country that are in crisis. So logically, I understand why the reagents aren't here. And it is appropriate to develop some level of prioritization so the reagents get to those hotspots. So we have to be patient. We do have access to testing. We want quicker access, And our director assures me it will come, and I believe him, and he's in contact with the vendor, the distributor. So we got to be patient. I think we got to be mindful. There are outbreaks in other parts of the country that are just at a whole different level than what we're experiencing right now. And so we got to be patient, we got to be kind, we got to be thoughtful, but we got to be vigilant, and vigilant at this point means routinely contacting the distributor for the reagents.
Right. Perfect.
Once they arrive, we will let you know.
Okay. Appreciate that. Thank you, Jerry. And just to kind of update, just some general operationally here at the hospital. So can you just update people on visitation for both the hospital, the nursing home, and procedurally here, pretty much everything is up and running at this point?
Yeah, so I got a few notes because it's a little different at the hospital than the nursing home. So at the hospital, we have visiting hours from 3 p. to 7 p. So 4 hours each afternoon into the early evening. Visitors who are coming to see patients are directed to go through the emergency department screening table, and the patient is only allowed one visitor at a time. So they will check in, and checking in, as you know, means getting screened. So the travel questions, the wellness questions, and temperature, and then a wristband, or for those of us who work here, a name tag band is issued for the day. And if there is a second visitor, they have to wait until the first visitor has come back and checked out, and then they are able to go out up to the floor. For the most part, that's worked well. We've had to work through, a few misunderstandings, but by and large, the community has been very understanding. The patients have been understanding, and everyone appreciates all of these things we are doing is to keep COVID out of the building and from not infecting the general public, our workforce, and the individuals getting care here. So I think that's working well. The nursing home was finally allowed to begin limited visits, and let me get my notes on that. So for the nursing home, it's limited visitation, okay? And there's a lot of criteria. We have 4 units, and there are only a certain percentage of visits that can occur. So they began this week, and the visits are being held outside on the Adirondack edge. It's this patio area we have at the front entrance of the hospital, and we are able to create 2 visitation points, which means 2 residents can have visitors at a time. The visits are scheduled from 10 a.m. to noon. And it's 1 day per week per unit. So on Wednesdays, let me just read. On Wednesdays, it's the first floor, sniff 1. On Thursdays, it's sniff 2. On Tuesdays, it's sniff 3. And on Mondays, it's sniff 4. And if we have a day that had to be canceled, we're using Friday as our makeup day. So as I said, the visits are scheduled from 10 to noon, and it's at a table. There's a framed out piece of plexiglass that separates the resident from the visitor. For the nursing home, they are allowed 2 visitors at a time. At the hospital, it's 1 visitor at a time. Just like the hospital visitations, the nursing home visitors must be screened. The resident is wearing a mask. The visitors are wearing a mask. So we're still, I think, we have to work out the logistics of and fine-tuning, getting the resident from the unit to outside, getting everybody screened. Obviously, with the time frame that we have and the number of visits that are occurring, we can only have so many visitors. So still working, to fine-tune that a bit. The goal, so let me tell you, the goal is obviously to increase visits, get more contact for the residents and their family. That's the goal. What we have to be mindful of, if we have a resident or an employee of the nursing home test positive, then the visitations will end for 28 days, so 4 weeks. So we are really putting a lot of effort into making sure people are COVID-free so that we can continue the visitation program.
Did you say those already started this week?
They started this week.
Yep.
Yeah, it was, this week was it Wednesday, Thursday of this week. Today there are no visits.
Yep.
The team is regrouping, okay, what worked well, what do we need to modify a little bit, and then they'll begin next week. There's a scheduling process involved, and we started.
That's
so
great.
I'm excited about that. The key will be practicing, wearing the face mask, social distancing, and washing hands frequently, all of the things to keep people COVID-free so we can continue with the visitations. I do not expect in the short time any wholesale changes to the directives from the DOH regarding nursing home visitations. So I think we got to work together with the families and be very disciplined and organized in scheduling these visits so we can get as many visits as we can.
Perfect. And the last topic, and I know we're kind of wrapping up our time here, so this is a little off the subject of COVID, but I know that when we spoke briefly before the interview started, the health system was excited that you got news this week that the certificate of need that you guys had filed for the Copenhagen Clinic has been approved. So
yes.
Did you just want to address that briefly?
Sure.
Because that is big news for the Copenhagen area, the county in general, and obviously the health system.
Yeah, I think it is exciting news because, part of what we're trying to support is local access to primary care. And those points are larger population centers in Lewis County. Copenhagen has had a clinic for years. So I met with the town or the village board back, it was June of 2019, first visit. Laid out our plan. Our hope was to get the CO1 approved sooner. But as you know, COVID happened and everything has just taken a little longer. But we have it approved. And we will be releasing the request for a proposal, so go out to bid next week. Our target date for construction to begin is October 1st. Our target date for completion is January 1st or December 31st. And we will staff the clinic 4 days a week with a nurse practitioner. So we're moving. This isn't a rebuild. It's a modernization of the space, bringing all aspects of the physical plant to current codes. So we're excited about it and to be able to offer the services 4 days a week. I talked with the town clerk a couple of days ago, and she was very pleased and going to share the information with the community and the elected officials. So that's very exciting.
Definitely. Okay. Well, I think that wraps up what we had for questions for you this morning. Did you have anything else that you wanted to add before we close out here?
Yeah, I just want to reinforce the science and the evidence supports wearing a mask, practicing physical distancing of at least 6 feet, and washing our hands frequently is really the most effective measures we have to reduce the risk of COVID-19 infection. We have been very blessed in Lewis County. I know there's some debate within our community about, wearing the mask and that sort of thing. the science supports it. The mask makes a difference. So the minute we're through this interview, my mask is going on, and as you know, as we walk through this health system, people are wearing their mask. Our visitors, our employees, the vendors who do work with us. We gotta remain disciplined and vigilant, and if we do, Lewis County will, from a COVID perspective, be one of the healthiest counties in the state of New York.
Okay, thank you.